Hello and welcome to Askimo TV. I'm talking today to Dr. Matthew Wilson. Dr. Wilson is a consultant orthopedic surgeon at the Exeter Hip Unit at the Princess Elizabeth Orthopaedic Centre in Exeter. Hi Dr. Wilson, how are you?
Very well, thank you, Joanne. Good morning.
Dr. Wilson, today's topic of discussion is going to be osteoarthritis. What is osteoarthritis?
So osteoarthritis is a degenerative condition affecting joints. It's typically associated with a loss of cartilage, a loss of the lining of the joints, which goes on to cause both pain and loss of function.
What causes osteoarthritis and who's at risk?
There's numerous causes of arthritis. Osteoarthritis itself is a particular form of arthritis, and that's most commonly what we call idiopathic, in that it just happens. There's certainly a large genetic element to it, in that if your family have a history of osteoarthritis, then you are probably more likely to get osteoarthritis. There are other inflammatory causes of osteoarthritis, such as rheumatoid arthritis is the most commonly known, where the lining of the joint gets very inflamed, and that in itself destroys the cartilage. Arthritis can also be post-traumatic, where someone has an injury to a joint and the cartilage lining is damaged, and then subsequently that cartilage lining breaks up and deteriorates and osteoarthritis begins.
What are the signs and symptoms that I may be suffering from this condition and should seek medical advice?
So typically someone suffering with arthritis of a joint will have pain associated with movement of that joint, maybe swelling of the joint if it's a superficial joint they can see and feel, and also a loss of function, so an inability to do the normal day-to-day things that they do, and maybe some of the more active things that they do.
How is osteoarthritis diagnosed and treated? Is surgery always required?
So no, not at all. Surgery is really the last resort. Osteoarthritis is diagnosed on a basis of history, so asking the patients questions about when and where they get their symptoms, what types of problems, what types of activities bring on their symptoms, and also on investigations, which are typically an X-ray, a plain radiograph of the area. Sometimes special imaging, such as a CT scan or an MRI scan, is necessary to confirm the level of arthritis, and very occasionally keyhole surgery to a joint is necessary to establish it. But surgery is not always necessary at all. There are many conservative measures.
If I do have to have surgery, what surgery would I have to have? And tell me just briefly about the procedure.
So surgery for arthritis can be either in forms of a replacement of that joint, if it's particularly severe, or for early arthritis, there are joint preserving techniques which can involve removing some areas of damaged cartilage to try and reduce the pain from that joint. So either preservation surgery or replacement surgery, in which both surfaces typically of the joint are replaced with an artificial surface.
And what is the prognosis for recovery after these surgeries?
So it very much depends on where the arthritis is, which type of replacement surgery you have, and also in addition, what your activity level is after that.
Just to end off, how can I prevent osteoarthritis, or is it even possible to prevent it?
Sadly, I think in the majority of cases it's not possible to prevent it. There are certainly things you can do to improve the lifespan of your joints, and probably the most important single thing that a patient can do is to keep themselves fit and healthy and to keep their weights down at a sensible level. Avoiding injuries is key as well, and dealing with any joint problems as they arise rather than letting them deteriorate. So seeking early advice and opinion is probably the number one thing.
Thank you, Dr. Wilson. Thank you so much for talking to me today.
That's a pleasure. Thank you, Joanne.